You may be under the impression that coma and vegetative state are the same thing. However, that is not the case. Differences in brain activity, brain metabolism, and body movements make it clear that coma and vegetative state are not one and the same. Let's learn more about what distinguishes these two different states of consciousness. There are two dimensions to consciousness. One's arousal or wakefulness, known as the level of consciousness, refers to the ability to respond to external stimuli. For example, someone in a high level of consciousness will reflexively kick their leg when hit in the knee or react to a painful stimulus. The second dimension to consciousness is one's awareness or content of consciousness. Awareness describes one's ability to understand their environment and, in the case of healthy individuals, respond to and act upon that environment. This figure shows the differences in these dimensions of consciousness across various brain states. In a healthy individual, both the level and content of consciousness are fully functional. In a coma patient, however, both of these dimensions are barely functioning. Coma is a state of unarousable unresponsiveness. The patient has no sense of self or of their surroundings. They will not respond to even intensely painful stimulation. If they survive, most patients come out of the coma in 2 to 4 weeks. However, the extent to which they recover widely varies, from minimally conscious state to vegetative state, and in rare cases, full recovery. This flowchart shows that coma is more of an intermediate state than a permanent one. As you can see, coma as a result of an acute injury can result in several different permanent states. In cases of vegetative state, level of consciousness is fairly normal, while content of consciousness is virtually non-existent. We should also mention the special case of locked-in syndrome. Levels of arousal and awareness are practically normal. The only condition limiting the individual is full-body paralysis. Vegetative state is characterized by wakefulness without awareness of self and surroundings. Observed motor activity is only reflexive. No voluntary movements can be made. Again, vegetative state can be intermediary. However, cases in which recovery is seen are rare. The distinction of persistent versus permanent vegetative state usually accurately describes the patient's expected outcome. Differences in levels of cortical metabolism are also seen. While in both cases the observed slow is global, or widespread across all of the cortex, in coma there is an average decrease of 50 to 70%, while in vegetative state there is an average decrease of 40 to 50%. This proves that more cortical activity is retained while in vegetative state than in coma. We already explained that when in coma, no motor activity is observed. This includes reflexive movements and response to painful stimuli. However, in vegetative state patients, these two motor activities are observed. But is the individual really in pain? Recent PET scans argue that while the body is reacting, the patient is not in pain. In vegetative state patients receiving a painful stimuli, primary somatosensory cortex activity was isolated and disconnected from the frontoparietal network believed to be critical for conscious perception. In conclusion, vegetative state differs from coma on a variety of levels, even though the terms are often used interchangeably. Even when it is difficult to detect differences visually, differences in things we cannot see, like brain function and degrees of consciousness, are a completely different story.